Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Aiims Norcet previous year related most important question answer. Part 14. Let's start. The first question. Identify the following image. Option A. Extrophy of bladder. Option B. Omphalocele. Option C. Laceration. Option D. Abrasion. The correct option is option A. Extrophy of bladder. In a patient with inhalation burn injury, which method of oxygen administration is most reliable? Option A. Nasal cannula at 5 liters per minute. Option A. Nasal cannula at 5 liters per minute. Option B. Non-rebreather mask with 100% oxygen. Option C. Venturi mask delivering 40% oxygen. Option D. Nasal cannula at 10 liters per minute. The correct option is option B. Non-rebreather mask with 100% oxygen. The medication clozapine requires regular monitoring of which laboratory value? Option A. Serum creatinine. Option B. Thyroid stimulating hormone TSH. Option C. Liver function test LFTs. Option D. White blood cell WBC count. The correct option is option D. White blood cell WBC count. Which of the following is a major complication of a compound open fracture? Option A. Fat embolism. Option B. Osteomyelitis. Option C. Avascular necrosis. Option D. Compartment syndrome. The correct option is option B. Osteomyelitis. A 35-year-old patient is being monitored in the ICU following trauma. The cardiac monitor shows a regular narrow complex tachycardia with a heart rate of 185 bpm, normal SpO2, and stable blood pressure. P waves are not clearly visible, and the rhythm appears sudden in onset. Based on the ECG waveform and vitals displayed, what is the most likely rhythm? Option A. Sinus tachycardia. Option B. Ventricular tachycardia VT. Option C. Supraventricular tachycardia SVT. Option D. Ventricular fibrillation. The correct option is option C. Supraventricular tachycardia SVT. Labor room nurse noted the finding in one of her primigravida clients as cervix dilation 5 cm, fetal station 1 and effacement 50%. Based upon the findings, nurse should understand that her client is in which phase of labor? Option A. Latent phase. Option B. Active phase. Option C. Transitional phase. Option D. Expulsive phase. The correct option is option B. Active phase. In a patient with SIADH syndrome of inappropriate antidiuretic hormone, which of the following is expected? Option A. Low urine specific gravity. Option B. Hypernatremia. Option C. Polyuria. Option D. Dilutional hyponatremia. The correct option is option D. Dilutional hyponatremia. Which of the following is the most definitive test for diagnosis pulmonary tuberculosis? Option A. Montauk's tuberculin skin test. Option B. Sputum smear for AFB. Option C. Sputum culture for acid fast bacilli. Option D. Chest X-ray. The correct option is option C. Sputum culture for acid base bacilli. During breech delivery in the labor room, the baby is delivering by the force of his own weight. The legs and trunk are allowed to hang freely, and as the nape of the neck appears as the perineum, the clinician gently lifts the baby's leg over the mother's abdomen to deliver the head. Which maneuver is being performed? Option A. Burn Marshall maneuver. Option B. Ridgen maneuver. Option C. Reuben maneuver. Option D. Javanelli maneuver. The correct option is option A. Burn-Marshall maneuver. Which of the following is a sign of adequate breast milk intake in the newborn? Option A. Sleeping through overnight. Option B. Having 6 to 8 wet diapers in 24 hours. Option C. Excessive crying. Option D. Feeding in every 5 to 6 hours. The correct option is option B. Having 6 to 8 wet diapers in 24 hours. A patient with a pulmonary artery catheter has a pulmonary capillary wedge pressure PCWP at 22 mm Hg. This indicates option A. Left side heart failure. Option B. Normal fluid status. Option C. Hypovolemia. Option D. Right-sided heart failure. The correct option is option A. Left-sided heart failure. Which of the following is a symptom of late decompensated shock? Option A. Slightly elevated heart rate. Option B. Narrowed pulse pressure. Option C. Falling blood pressure. Option D. Apprehension and restlessness. The correct option is option C. Falling blood pressure. Under UIP, how is the rotavirus vaccine administered to infants? Option A. 5 drops oral liquid formulation. Option B. 2 drops oral lyophilized formula. Option C. 0.5 ml intramuscular injection in thigh. Option D. 1 ml subcutaneous injection in upper arm. The correct option is option A. 5 drops oral liquid formulation. A psychiatric patient keeps repeating the same phrase again and again. For example, I want to go home, 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 home. This phenomena is called option A. Echolalia. Option B. Echopraxia. Option C. Perseveration. Option D. Verbigeration. The correct option is option D. Verbigeration. The Brudzinski sign and Kerning sign are classic assessment findings for which condition? Option A. Encephalitis. Option B. Parkinson's disease. Option C. Multiple sclerosis. Option D. Meningitis. The correct option is option D. Meningitis. Which of the following laboratory findings is expected in a patient with primary hypothyroidism? Option A. High TSH and high T4. Option B. High TSH and low T4. Option C. Low TSH and high T4. Option D. Low TSH and low T4. The correct option is option B. High TSH and low T4. After a tonsillectomy and adenectomy, what nurse education should be given to the mother of the child? Option A. Observe for frequent swelling. Option B. Encourage vigorous gargling. Option C. Give cool water and food immediately. Option D. Allow the child to resume normal activity without restrictions. The correct option is option A. Observe for frequent swelling. Identify the FiO2 rate in this given Venturi mask. Option A 40%, option B 31%, option C 60%, option D 28%. The correct option is option A 40%. A patient taking lithium for bipolar disorder develops new muscle weakness, cord tremor, nausea and drowsiness. What is the nurse's priority action? Option A. Encourage oral fluid and continue the next lithium dose. Option B. Assess serum lithium level immediately. Option C. Administer an anxiolytic for tremors. Option D. Restrict sodium intake and monitor intake output. The correct option is option B. Assess serum lithium level immediately. Which of the following is an example of distributive shock? Option A. Anaphylactic shock. Option B. Burn shock. Option C. Hemorrhagic shock. Option D. Surgical shock. The correct option is option A. Anaphylactic shock. Leading cause of neonatal mortality in India is option A. Infection. Option B. Birth asphyxia or trauma. Option C. Diarrhea. Option D. Prematurity and congenital malformation. The correct option is option D. Prematurity and congenital malformation. Which nursing action is most important while caring for a client after cardiac catheterization? Option A. Provide rest. Option B. Administer oxygen. Option C. Check the pulse distal to the puncture site. Option D. Monitor electrocardiogram every 15 minutes. The correct option is option C. Check the pulse distal to the puncture site. What is the first phase in wound healing? Option A. Inflammatory phase. Option B. Hemostasis phase. Option C. Maturation phase. Option D. Proliferative phase. The correct option is option B. Hemostasis phase. What comes under category 1 of the biomedical waste management? BMW. Option A. Animal waste. Option B. Microbiological and biotechnical waste. Option C. Human anatomical waste. Option D. Discarded medicines. The correct option is option C. Human anatomical waste. What is the recommended period of taking a postcoital contraceptive pills after unprotected intercourse? Option A within a week, option B within 4 days, option C within 3 days, option D within 5 days. The correct option is option C within 3 days. A 75 years old male patient presents to the outpatient department with complaints of forgetfulness and difficulty concentrating. The nurse conducts the mini mental state examination MMAC and the patient scores 19 out of 30. Based on this score, how should the nurse interpret the patient's cognitive status? Option A. Normal cognitive function. Option B. Mild cognitive impairment. Option C. Moderate cognitive impairment. Option D. Severe cognitive impairment. The correct option is option B. Mild cognitive impairment. A patient is started on intravenous hydrocortisone. Which nursing action should be performed after administration? Option A. Assess blood glucose level. Option B. Encourage high sodium diet. Option C. Withhold fluid intake. Option D. Monitor for hypokalemia only. The correct option is option A. Assess blood glucose level. Identify the ECG given below. Option A. Atrial flutter. Option B. Atrial fibrillation. Option C. Sinus tachycardia. Option D. Normal sinus rhythm. The correct option is option C. Sinus tachycardia. Identify this instrument. Option A. Alice forceps. Option B. Valsalm forceps. Option C. Cattle forceps. Option D. Cocker's forceps. The correct option is option A. Alice forceps. A nurse is caring for a patient with autonomic dysreflexia. Which of the following should be the nurse's first action? Option A. Assess for a fecal impaction. Option B. Check for a distended bladder. Option C. Elevated the head of the bed to a high follower's position. Option D. Administer an antihypertensive medication. The correct option is option C. Elevated the head of the bed to a high follower's position. Which of the following ECG changes is the most specific indicator of an evolving acute myocardial infarction? Option A. Inverted T waves. Option B. ST segment elevation. Option C. Prominent P waves. Option D. ST segment depression. The correct option is option B. ST segment elevation. A patient's laboratory report shows serum potassium 6.37 milliequivalent per liter. The doctor orders intravenous calcium. What is the nurse's priority action? Option A. Administer calcium injection over 10 to 15 minutes and monitor for arrhythmias. Option B. Administer calcium as a rapid IV push. Option C. Hold calcium and repeat potassium after 1 hour. Option D. Give oral calcium and potassium binder. The correct option is option A. Administer calcium injection over 10 to 15 minutes and monitor for arrhythmias. A patient brought in the emergency department with kerosene poisoning. On duty nursing officer, know that which of the following nursing intervention should is most appropriate. Option A. Immediately induce the vomiting. Option B. Gastric lavage is contraindicated. Option C. Insert 36 French orogastric tube. Option D. None of the above. The correct option is option B. Gastric lavage is contraindicated. A patient with hypertension and diabetes mellitus presents with metabolic acidosis. Arterial blood gas shows normal pH. Which electrolyte should the nurse monitor and manage carefully? Option A. Potassium. Option B. Sodium. Option C. Calcium. Option D. Magnesium. The correct option is option A. Potassium. Which of the following is a once a week contraceptive pills? Option A. Chaya. Option B. Shahili. Option C. Mala N. Option D. Mala D. The correct option is option A. Chaya. Which of the following is a live attenuated vaccine? Option A. Inactivated polio vaccine IPV. Option B. Measles MMR. Option C. Hepatitis B vaccine. Option D. Influenza vaccine. The correct option is option B. Measles MMR. A 35 weeks pregnant client is undergoing a non-stress test NST. During the 20-minute examination, the nurse notes 3 fetal movements accompanied by acceleration of the fetal heart rate, each 15 bpm and lasting for 15 seconds. The nurse interprets this test to be option A. Non-reactive, option B. Reactive, option C. Positive, option D. Negative. The correct option is option B. Reactive. A female patient presents with secondary amenorrhea. Her investigations reveals a karyotype of 55XO and elevated FSH levels. Which of the following is the most likely diagnosis? Option A. Turner syndrome with primary ovarian failure. Option B. Polycystic ovarian syndrome PCOS. Option C. Klinefelter syndrome. Option D. Edwards syndrome. The correct option is option A. Turner syndrome with primary ovarian failure. A 17-year-old girl presents to the Gynecology OPD with complaints of absence of menstruation despite normal secondary sexual characteristics. She reports clinic lower abdominal pain every month. On physical examination, a bulging bluish membrane is seen at the vaginal opening, and she is diagnosed with an imperforate hymen. What is the most likely diagnosis? Option A. Option A. Cryptomenorrhea. Option B. Metromenorrhea. Option C. Oligomenorrhea. Option D. Primary amenorrhea due to hypogonadism. The correct option is option A. Cryptomenorrhea. A patient with a history of alcohol use disorder presents with confusion, ataxia, and ophthalmoplegia. The nurse recognizes this as sign of option A. Wernicke's encephalopathy, option B. Hepatic encephalopathy, option C. Delirium tremens, option D. Korsakoff psychosis. The correct option is option A. Wernicke's encephalopathy. What is the primary pharmacological action of nitroprusside in the management of a hypertensive crisis? Option A. Beta adrenergic blockage. Option B. Selective arterial vasodilation. Option C. Calcium channel blockage. Option D. direct acting vasodilator for both arteries and veins? The correct option is option D, direct active vasodilator for both artery and veins. In a patient with pheochromocytoma, which of the following assessment is contraindicated? Option A, abdominal palpitation. Option B, collection of 24 hours urine for VA. Option C, checking blood glucose level. Option D, frequent blood pressure monitoring. The correct option is option A, abdominal palpation. In a patient with acute respiratory distress syndrome ARDS, which ventilator setting is specifically used to prevent alveolar collapse at the end of expiration? Option A, positive end expiratory pressure PEEP. Option B, inspiratory flow rate. Option C, tidal volume of 10 ml per kg. Option D, FiO2 at 100%. The correct option is option A, positive end expiratory pressure PEEP. Which of the following ABG results is most indicative of a patient in early stage salicylate aspirin poisoning? Option A, metabolic acidosis. Option B, respiratory alkalosis. Option C, respiratory acidosis. Option D, metabolic alkalosis. The correct option is option B, respiratory alkalosis. A patient with suspected myasthenia gravis is undergoing a tensilin intraphonium test. Which of the following findings would confirm the diagnosis? Option A, generalized muscle weakness and respiratory distress. Option B, a temporary improvement in muscle strength. Option C, the development of muscle fasciculation. Option D, a sudden increase in heart rate. The correct option is option B, a temporary improvement in muscle strength. A patient with gestational trophoblastic disease GTD is under treatment for the past 3 months. Now she presents with vaginal bleeding and her serum beta HCG levels are rising instead of declining. She visits the midwife for evaluation. What does this clinical picture indicate? Option A, normal course of disease. Option B, treatment failure or persistent GTD. Option C, developed trophoblastic neoplasm. Option D, molar pregnancy regression. The correct option is option B, treatment failure or persistent GTD. In a twin pregnancy, identify the following image. Option A, dichorionic monoamniotic pregnancy. Option B, monochorionic diamniotic pregnancy. Option C, monochromonic monoamniotic pregnancy. Option D, dichorionic diamniotic pregnancy. The correct option is option C, monochorionic monoamniotic pregnancy. An image shows a nurse applying pressure to the mother's lower abdomen during the third stage of labor. What is the nurse doing? Option A, giving fundal pressure. Option B, assisting with controlled cord traction. Option C, applying uterine massage after placenta delivery. Option D, delivering the placenta by compression. The correct option is option A, giving fundal pressure. The image shows a vaccine used to protect against human papillomavirus HPV infection. This vaccine is given as an intramuscular injection and helps prevent certain type of cancer and genital warts. Which disease is primarily prevented by this vaccine? Option A, cervical cancer. Option B, breast cancer. Option C, lung cancer. Option D, liver cancer. The correct option is option A, cervical cancer. Identify the following image. Option A, Bartholin cyst. Option B, urethral caruncle. Option C, Bartholin abscess. Option D, vaginal polyp. The correct option is option A, Bartholin cyst. Thank you for watching. Please like and subscribe.